Okay, so when we talk about diagnosis, first we're going to have done the standing flexion test. The standing flexion test, whatever side it's positive for, is the side that goes first and furthest when they bend forward, and that's the side we name the somatic dysfunction for. So, like we said, there's different kind of somatic dysfunction of the pelvis. And just to name them, there's anteriorly rotated ilium and there's posteriorly rotated ilium. You can have a superior shear of the ilium. You can have an inferior shear of the ilium. You can also have a superior inferior shear of the pubes, and something we won't be talking about much, but just to mention it, you can have an out flare of the ilium and an in flare of the ilium. So now I'm going to show those to you with a hand model of what your ilium is going to be doing. Okay, so if we were to imagine that my thumbs were on the PSISs, my pointer fingers were on the ASISs, and the pinkies were the pubes, this is my pelvis. So what happens when you have a right standing flexion test that's positive on the right, you name things as to what's going on the right side of the pelvis. So if your right ASIS is inferior and your right PSIS is superior, then that would, of course, be a anteriorly rotated ilium. Now bringing that back to neutral, let's try a posteriorly rotated ilium on the right. The right PSIS will fall inferiorly, and the right ASIS will go superiorly. So that's a posteriorly rotated ilium. So once again, neutral, anteriorly rotated ilium, neutral, posteriorly rotated ilium on the right. Now there's something called a superior shear where both the ASIS and the PSIS will feel superior when you're looking for them in comparison to the left side. So this is a superior shear of the ilium on the right side. Conversely, going back to neutral, you can have an inferior shear on the right. And because bone is malleable in a live person, it's not dry, you can have torques and torsions. So you can have just simply a superior or an inferior shear of the pubic bone, which is hard for me to show you without moving my other fingers. Likewise, there's something called an inflare. So looking at the anterior part of a person, and this comes with experience to know who has an inflare and who has an outflare. The ASISs just seem closer to the midline, closer to the umbilicus than it would in some other person. And coming back to the neutral, an outflare would be the converse, where the ASISs seem flared out.